Health Administration Leadership and Special Topics by me, Elena Peltola. In this presentation, I'll be talking about the effects of the pandemic on our overall health and explain how healthcare policies are to deal with this matter. An outbreak of a disease that occurs over a widespread geographic area and typically affects a significant proportion of the population. This is a definition of pandemic given by Merriam-Webster Dictionary. We are in a pandemic right now, and that is negatively impacting our social, emotional, and physical health. Healthcare policies. Hospitals need to know how to deal with the social, emotional, and physical dangers of their patients, and they need to have policies in place to deal with this. They need to be strong, they need to be specific, and they need to have the care and comfort of their patient in mind. They also have to know the warning signs of these certain disorders. Social dangers, possible causes and warning signs, differences in personality and/or behavior, frequent mood swings, isolating themselves, engaging in risky behavior such as using tobacco or alcohol, and not wanting to leave their home and/or their safe place. Some remedies to combat these are to reach out to people who exhibit these behaviors. If you realize someone is exhibiting these behaviors, just simply reaching out to them can make their day. If it is you exhibiting these behaviors, you can get help through counseling or going to a hospital. Your rights are protected by the HIPAA law, and when you go to a hospital, you are protected, and those doctors cannot tell anyone else what you are going there for. And another way to combat this is surround yourself with positive people. Just simply surrounding yourself with positive people can just make you happier. Warning signs of emotional dangers. Different warning signs are different for each age group and first responder occupations. So children and teens experience competing with siblings for their parents' attention, they lose interest in school, they increase anger levels, they may start experimenting in risky behavior, and they could also become withdrawn. In adults, they have frequent anger and crying spells, they can feel tired and fatigued, they can avoid family and friends, they may lose interest in things that used to bring them joy, and they could possibly also develop eating issues. In first responders, they may experience rapid heart rate and frequent headaches. They could have issues solving problems and being disoriented. They could be taking unnecessary risks and being more irritable than normal. Remedies for improving emotional health include doing things that make you happy or used to make you happy. You will never know if it would make you happy if you won't try it again. Another way to combat this is to talk to a counselor or another trusted person. Simply talking to someone could just make your day and make you feel a whole lot better. You can also try having a set schedule or just taking time for yourself. Some physical dangers and the remedies include health issues due to the lack of physical activity, poor mental health, unhealthy weight gain, and insecurities that weren't there before. To combat this, you can try going for daily walks, hire a trainer, just simply moving your body and doing things around your house, or find exercises you enjoy. On the left, you see a diagram of adults reporting depressive and anxiety disorders. This is the early COVID-19 pandemic results from May to July. As you see, the percentages increase as each month goes on. So COVID is obviously negatively impacting our mental health. On the right, you see different age groups and different groups of people. The group that experiences the most anxiety and depression is people in fair to poor health. Here is a health triangle. On the left, there is a balanced health triangle. Their mental, social, and physical health is all balanced and all healthy. On the right, you see physical activity is lacking, but their mental and social health is still pretty okay. In order to be completely healthy, you need your physical health to also be healthy, and vice versa. I will now share a video given by a therapist.
Incredibly busy. We know how hard these times have been on all of us and will be. So what advice can clinical psychologists offer to any of us struggling with separation, loneliness, work from home, and just about everything else? CNBC's Contessa Brewer with some answers.
Brooke White is an avid runner, a mom supervising remote learning for her kids, and a clinical psychologist. She says in the conversation about frontline workers, mental health professionals are being left out.
We are not exempt from the stress of this time. We are holding up the weight of an enormous amount. A huge percentage of people have had COVID. Many, many, many millions of more than that have had mental health issues.
The demand for help is so great. Online therapy site Talkspace has seen a 100% increase in new users since February. Brooke now sees 35 patients per week, a 40% increase to her pre-pandemic caseload. Her go-to prescription for anyone feeling anxiety? First, talk to someone, whether a friend, family, or professional, but don't sit alone with the stress. Exercise.
It helps with anxiety, with stress, with trauma, with depression. You know, it's one of the best tools we have for mild depression is exercise.
Get outside. Sunshine, fresh air, and nature work wonders. And practice mindfulness.
Moving in and out.
I asked her to show me.
Come back to your breath.
Do you practice what you preach?
Definitely. I would not be able to continue to do my work if I wasn't practicing what I'm preaching.
Well, speaking of preaching, prayer is another way of practicing mindfulness. And another recommendation here, help others, reaching out to others to be a resource for them. You can volunteer in your community because it's hard to surrender to self-pity if you're not focusing on yourself.
Yeah, good
Jeff?
point.
So as she said, you really need to focus on yourself throughout this pandemic. This pandemic is negatively impacting many people's mental health, and you really need to focus on yourself. I hope you learned something throughout my presentation in this video. Thank you for listening.